Associates, the show that's helping people see better and feel better all over Florida. It's Ask the Doctor with board-certified optometric physician, certified nutritional specialist, and popular radio host, Dr. Michael Lange of Lange Eye Care and Associates.
Doctor, my eyes, they cannot see the sky. Is this the price for having learned how not to cry?
Okay, good morning. And welcome to Ask the Doctor. I'm your host, Dr. Michael Lange. As usual, if you've got a question regarding your vision, eye care, or a nutritionally related topic, you can pick up the phones and give me a call at 727-586-2820. That's 727-586-2820. If you're new to the program, who's Dr. Lange? Well, I'm a board-certified optometric physician. I'm also a certified nutritional specialist. I am the founder of Lange Eye Care and Associates, the founder of Fortifeye Vitamins, and the founder of Paleo Simplified. So what do we talk about in this show? We talk about all sorts of great things. We talk about the latest in nutrition for eyes and for your entire body. And this is a call-in show, a live call-in show, so participation is encouraged. You can also pick me up on all my Facebook pages. I'm probably not streaming on all my Facebook pages yet, but we are streaming on News Talk Florida Facebook, and I will get us up on our pages here in just a minute. All right, first question of the day, we're going to go to Bob. Bob, good morning. Welcome to the program.
Good morning, Dr. Lange. You're going to be off the air for the next couple of weeks, right?
Well, next week I will be in New Orleans racing a big NASA race on Friday, Saturday, and Sunday. So I will be off the air next week. The following week, I should be live. And then the following week will be my birthday. On the 15th, I'll be in Miami
that's what
racing.
I was just going to say. In the event that you do go to racing on your birthday, happy birthday.
Thank you, Bob. That's awful very nice of you.
Okay. My question was kind of long time in developing here, but years ago, I worked in a manufacturing facility where there was an occasional bit of arc welding going on.
Mm-hmm.
And I looked through a window at a very bad time, and I guess they call it flash.
Mm-hmm.
And it burnt my retina. Now, I've been wearing blue light defense lenses for a number of years now, and I have a facility right next door to where I work that does some outside arc welding. So I'm constantly, I try not to look in that direction, but it's still there. Do you think that the blue light defense will have a safety factor for that arc welding?
That's a great question. So how far away is this? If somebody's doing some welding, how far away are they from you when you're looking at them?
Well, by the time I get to them, I'd say maybe 50 yards.
Yeah, you're Bob, you're going to be safe. You're not going to have any problems from blue light. As you know, though, flash burn can be very, very painful. But at 50 yards away, you should be safe. No, blue light exposure is going to harm you. If you're wearing your blue light defense lenses, that's going to block the UV and the harmful range of the blue light as well. And you're not going to be looking at it for a long period of time. You should be safe. You really should be.
Okay, well, I don't intentionally look at it. It's more of a indirect flash. I'm aware of it, but I'm not looking, quote, at it.
Right. No problems whatsoever. I guarantee it. All right. That's my Louisiana Nolans Coon-ass accent coming out.
Very good. Doctor, be careful next week. Stay off the wall.
I plan on it. Thank you, Bob. Bye-bye. All right. I've just about got it shared on all our Facebook pages here. So be patient. I think we got one more to share right there. Boom. All right. Now we're up on, about 15 different Facebook pages live. So you can watch us on News Talk Florida. News Talk Florida Facebook, or Dr. Michael Lange Facebook, or Lange Eye Institute Facebook, Fortifeye Facebook. There's all sorts of places you can watch us right now. Remember, this is a live call-in show. If you have a question regarding your vision or eye care, a nutritionally related topic, don't hesitate picking up the phones. Call me at 727-586-2820. I am going to announce again, October 20th, we have our big fall festival at the Lange Institute in the Villages. Put that on your calendar. You don't want to miss it. We usually have a few thousand people that show up. October 20th, Lange Institute. We're going to have music. We're going to have food, lots of food, free food, lots to drink. We're going to have lots of giveaways. We're going to have frame vendors from all over the place, a frame trunk show, amazing deals on Fortifeye vitamins and all frames and lenses and anything we carry, paleo simplified blue light defense lenses. We're going to have it's going to be a race theme. I'm going to bring 2 of my race cars and maybe another car. A bunch of my buddies that we race with are going to bring their race cars. It's a good possibility. I'm not going to announce any names, but some world famous race car drivers may be there with some of their cars too. So it's October 20th, Lange Institute in the Villages, Florida, just a hop, skip, and a jump from wherever you are. If you have a cool car, be more than welcome to bring it out. We're going to have a whole area set up, so we'll have like a little show area for the cars, so we can turn it into a pretty big car show. If you're in Ocala, Gainesville, the Villages, Tampa, Clearwater, Sarasota, any place like that, come on by Lange Eye Institute on October 20th. We'll also be doing eye exams on that day. Dr. Yadi Exposito and Dr. Lori Caputi will be doing eye exams. I will not be doing eye exams. I'm going to be mingling and socializing like I do at the fall festivals. All right, before we take the next call, I just want to mention all of you listeners in Sarasota, a lot of you listen and are always wondering where you can get Fortifeye vitamins in Sarasota area. Well, the Professional Supplement Center in Sarasota, write that down, Professional Supplement Center in Sarasota. It's right there on Palmer Crossing Circle. Palmer Crossing Circle, Professional Supplement Center, Sarasota, carries just about all of our Fortifeye vitamins. I'll give you their phone number. Write this number down. It's 888-245-5000. Once again, for Professional Supplement Center in Sarasota, they carry just about every Fortifeye vitamin. They carry the macular defense, the focus, the probiotics, the AREDS 2, the superfood. The phone number is 888-245-5000. Now, since you got your pen and paper handy, write down a couple of other things. I want you to go to a website, bluelightdefense.com, www.bluelightdefense.com. Read the website. It will enlighten you on how blue light that is coming from your computer, your tablet, your phone, the LED lighting, the fluorescent lighting, is harming your eyes. And it's creating a poison that's destroying your photoreceptors in your retina, aka potentially causing macular degeneration. Also, it talks about nutrition on there, how we can slow down this through proper nutrition. Wearing lenses called blue light defense lenses. If you look at me right now, I'm putting a pair of glasses on. It's kind of a cool blue frame. These are blue light defense lenses. It blocks all the harmful blue light coming from the computer, your iPad, your iPhone, or whatever phone you have, the television, the LED lighting. We're going to talk a lot more about blue light and the damaging effects in a few minutes, but it's very important to block that blue light. Blue light is associated with, believe it or not, cancer, diabetes, heart disease, obesity, anxiety, depression, and of course, the one I'm in tune with, macular degeneration. Thing I like about blue light defense lenses, they're totally clear. Many blue light blocking lenses are yellow and brown or orange. These are totally clear, and they block the most damaging blue light. All right, bluelightdefense.com. Let me give you a code because you can actually buy these over the internet. These are high-quality blue light defense lenses. They're clear. They're not the imitations ones that you can buy for $9.99 that do not work. Remember, you get what you pay for. So use a code. Write this down, BLUE40. BLUE40. You put that in the promo code at bluelightdefense.com or Fortifeye.com, either website, to buy the blue light defense frame and lenses, non-prescription. Use Blue 40. You get 40% off. This is a high-quality frame, amazing quality lenses, anti-glare coating on them. They're clear and they block the blue light. A blue laser will not go through these lenses. They work. So use that code Blue40, and you use it at bluelightdefense.com or fortifeye.com. Also, if you want to get readers, you can go to the section right at checkout where you do the promo code. There's a section you can type in notes, and you can tell Blue Light Defense of Fortifeye Vitamins what power you want, +1, +2, +3, +150, and it's the same price. Then they will send you the prescription for readers only in that. Okay, let's go back to the phones. I think Steve in Clearwater. Good morning.
Yeah, when I was doing some research about that problem I told you I thought I might have, I found something really, really weird here. There's an eye problem, and it's more neurological, and I don't know if you've ever heard of this. It's called grapheme color synesthesia.
Nope, can't say I have.
What it is that people get this, and it's a problem in the routing in the brain, in the occipital lobe.
Mm-hmm.
And what it is when people see numbers, grapheme color synesthesia,
Wow.
They will see, like they'll always see a 1 is red. They'll always see a 2 is blue, something like that. And they think that kids that play with, babies that play with the blocks that have numbers on them, if they're red, the brain gets to think that every time they see a 1, it's going to be red, and every time they see a 2, it's going to be blue, because every block that they've had. You follow what I'm saying?
Yeah, I am.
And it's really a strange thing, and you might look at that and see what you think really might cause that. It's called grapheme color synesthesia, and it seems to be that people will always see they'll get a thing where they'll always see a 2. If they see a 2, it'll always be blue, or if they see a 4, it'll always appear to be red to them. It's really strange.
Steve, can you email that to me just so I won't forget, so I can look at that?
Yeah, we'll do that. They think it says they thought it was due to kids playing with refrigerator magnets, but they found that a lot of other people that have never done that have this. It's really strange.
That's the first time I've ever heard of that.
I know.
I learn something every day from you. Every Saturday.
This is weird. I don't know. I've got to figure it out myself. But anyway, okay, very good.
All right, Steve.
Have a little fun. Okay.
Thanks, buddy. Bye. I'll look forward to that email. Steve always has some interesting things. I got to tell you, Bizarro Land. That is kind of strange. We talked a lot about astronauts and eye problems related to astronauts not too long ago with Steve. He always makes you go, makes my mind wonder. All right, phone lines are open. 1-866, no, that's the wrong one. 1-727-586-2820. 1-727-586-2820. I'm going to give you the phone number for Fortifeye Vitamins during the week. You can call Fortifeye Vitamins Monday through Friday. Their phone number is 866-503-9746. That's 866-503-9746. You can certainly go to fortifeye.com. Fortifeye is Fortifeye. Remember, I'm an eye doctor, so that's why it's I. Fortifeye.com. Also, learn more at drmichaellange.com or langeyecare.com. A lot of you will follow me on Instagram. It's a good place to follow me because I usually give a lot of promo codes that are only good for 24 hours that you can save a bundle of money on stuff. And, I got hijacked. I had close to 100,000 followers on Instagram. It took me, about 5 years to build that. And somebody hijacked me from Russia, believe it or not, and changed the name, and I couldn't get it back, and Instagram wouldn't give it back to me. So I started a new one. So now it's just Dr. Michael Lange, bottom dash, Dr. Michael Lange, bottom dash at Instagram. And, I got about 5,000 followers now. So I got another 95,000 followers to get back to where I was. So help me out. Follow me on Instagram. All right, let's go back to the phones. Let's see. Sandra in Ocala. Good morning.
Hi. Good morning, Dr. Lange. I have a question about vitamins.
Mm-hmm.
I primary doctor told me, don't take all those vitamins because they're mostly fillers and it's not good for your kidney. And I'm an RN, so I get what he's saying, but I wanted your take on it, and also to ask you what, if any, fillers you use in your vitamins.
Okay, so that's a great question. And, there's some validity to that, but not a whole lot. If vitamins are developed correctly, all right, then the bioavailability is going to be huge, okay? So, but the problem is over-the-counter vitamins, Sandra, most over-the-counter vitamins I don't recommend because, number one, they're filled with synthetic binders and fillers, like you just mentioned. But synthetic vitamins like vitamin E, D-alpha, DL-alpha tocopherol has been associated with heart problems. Filled with beta-carotene that blocks the absorption of lutein, zeaxanthin, and astaxanthin, actually predisposing you to get macular degeneration. And people don't realize that if you're a smoker, like half of our country, beta-carotene increases your risk of lung cancer. So beta-carotene shouldn't be in a vitamin. And then vitamin A palmitate or retinol, the fat-soluble form of vitamin A, blocks the absorption of vitamin D. But yet that's in every multivitamin out there. It's associated with neurodegenerative disorders. Zinc oxide associated with neurodegenerative disorders, and copper also associated with Alzheimer's and dementia. And you being a nurse, I mean, just about everybody when they get to a certain age now is starting to have cognitive decline and dementias. So there's a lot of products that just have not been thought of, the multivitamins out there. The binders and the fillers, I really wouldn't worry about that because most of those binders are basically fiber, okay? Now, a lot of companies are using synthetics for that binder, and those in high dosages may not be good. Our Fortifeye vitamin line, we don't use, all right, so it's based on what we're trying to deliver. So an example, I'm holding up in my hand Fortifeye Focus. This is a fish gelatin, organic olive oil is the delivery system, and it utilizes lutein, zeaxanthin, and astaxanthin. There's no binders or fillers at all in it, and it absorbs very rapidly. Our probiotics, we use a vegetable capsule, no binders or fillers. So now we get to something that does have a binder or filler, like the Fortifeye multivitamin, the macular defense, or the complete advanced. I have to use a tablet for this, and we've redesigned this 14 times in the last 12 years. So this is a USP certified tablet that has a dual phase delivery system. So for it to break down slower, we have to put a binder in it, okay? So it doesn't break down immediately. And this is to maximize the absorption because we put a lot of different things in this. So we use vegetable-based types of binders. They're basically fiber, vegetable-based fiber, nothing synthetic. But I wouldn't be too concerned about people looking at magnesium stearate and things like that because those are usually just in the coatings and it's such micro amounts. You know, if you gave that to a rat in large amounts every day for a year, you know, it could cause potential problems. So I wouldn't be overly concerned about it. The main thing I would look for is synthetic nutrients that are in that. And the things I mentioned, beta-carotene, vitamin A, copper, and zinc oxide.
Okay. And also the my eye doctor recommended the MacuHealth.
Mm-hmm.
And I was just wondering what that was in comparison to your macular defense.
All right,
I tend to trust you more than anyone.
So MacuHealth is a good company. It's a great supplement. We actually use it a lot for our macular degeneration patients. MacuHealth is a combination of lutein, zeaxanthin, and mesozeaxanthin, all right? And Dr. Tolentino has been doing some studies along with me utilizing the combination of MacuHealth and Fortifeye Focus, all right, especially for macular degeneration patients. Now, here's the caveat. You never use them at the same time because the mesozeaxanthin in the MacuHealth has a potential to block the absorption of the lutein, zeaxanthin, and astaxanthin that's in the Fortifeye Focus. So you could take both of them, but you would take one in the morning and one in the evening. You wouldn't take them at the same time. But MacuHealth is absolutely a wonderful supplement, and it's got a lot of good science behind it. And it's not one of these you can buy over the counter like some of these other ones that are out there that I'm not going to mention any names due to legal ramifications. But I think MacuHealth is a very good supplement. Absolutely.
Okay. All right, Dr. Lange, thank you so much. Keep up the good work.
All right. Take care. Bye-bye. All right. We got a lot of good callers. You're listening to Ask the Doctor. I'm your host, Dr. Michael Lange of the Lange Eye Institute in the Villages. If you've got a question regarding your vision, eye care, or a nutritionally related topic, give me a call right now. 727-586-2820. That's 727-586-2820. And if you're following us on Facebook, maybe hit that little like button so I can know how many of you guys are seeing us loud and clear. One more time, remember, if you're in Sarasota, you want to get the Fortifeye vitamins, go to Professional Supplement Center in Sarasota. Also, I want to mention we do have some new crunch coming out. Paleo Simplified has a great crunch that's global right now. You can get it on Amazon. We've got a new one coming out called Praline Crunch. And I worked with some buddies of mine in New Orleans to get the flavor down. And it really tastes like pralines, but it has very minimal sugar and it has a few carbs, but it's delicious. It's an oat-free crunch. No oats. Remember what I think about oats. I don't love oats. Every now and then it's okay. But oats can actually block the absorption of many antioxidants. It has phytates in it that probably aren't the best thing in the world for you. If you want to make oats good for you, get some steel cut oats, soak them overnight, put a chigger of apple cider vinegar in it. That will reduce it. Or you get sprouted oats. That reduces the phytates as well. All right. Also, Fortifeye Vitamins. I've been working on a supplement for dry eye called Fortifeye Dry Eye Therapy or Fortifeye Dry Eye Extreme. It's going to be coming out soon, too. It's going to be a combination of our omega-3, our Fortifeye Focus, and something called GLA, gamma-linolic acid from black currant seed oil. The combination is amazing for skin health, joint health, but helping dry eye naturally. And then I've been working on our protein. As you know me, I always try to make things better and better and better. And so recently I redeveloped our protein, our vanilla protein, and what we're doing now, it's coming from New Zealand grass-fed cows. We used to get it from the cheese, believe it or not. But now there's a new way to pull this whey protein from the casein. And what it does, it gives a much higher amino acid profile for all of us that are into working out and you want the maximum from your protein drink. But it changes the color a little bit. It's a little whiter instead of yellow color. And it doesn't mix quite as well. You got to shake it in a shaker a little longer, or certainly put it in a blender. But it is got a higher amino acid profile, so a little more protein is there, very good for you. So I'm working on the chocolate one now, and I've been experimenting, trying to get rid of that stevia aftertaste. So what we've been doing is using a little bit of coconut sugar. Coconut sugar is actually natural. It has high mineral content, has inulin in it, which is a prebiotic, and it's low glycemic index sugar, so it's diabetic friendly. So what we're doing, we're still going to use stevia, but I'm adding a little coconut sugar, so we still don't have many grams of sugar, still be diabetic friendly. Low carb diet will still be working, but I think it's going to get a taste down a little bit better. Also, some people have an effect from stevia since it's so sweet. It causes you to become hypoglycemic. Adding this tad bit of sugar should reduce that hypoglycemic reaction. All right. Let's open up the phones. We got a lot of people on hold, so we're going to go, I think, first. I don't know who's first. I think it might be maybe this is Mark or Hugh. Good morning. Who's this?
Good morning.
Is this Mark or Hugh?
Mark.
Oh, hey, Mark. All right. That's who I was trying to retrieve, but all the lights were lighting up. I was a little confused.
All right.
What can I do for you?
Yes, sir. First of all, I've been listening to you for about a year now. Really enjoyed your show. For the past 2 years, excuse me, I've been experiencing floaters and shower floaters and an occasional flash from my peripheral vision. I went to the Retina Center in Ocala. They put me on steroid drops.
Mm-hmm.
That made the situation worse. They sent me to a specialist in St. Petersburg.
Mm-hmm.
She, again, put me on a steroid pill for 30 days, a strong dose. That didn't help. She wanted to further that treatment, and I decided to decline that. I didn't take the medicine. I didn't feel like basically going to be a lifelong prescription, you know, if it did work anyways. And I was just calling to see if maybe you had any suggestions. I did have a cataract surgery done 2 months ago, as a result of the steroid drops, it basically accelerated my cataract.
Right.
And I was hoping when they did that procedure that maybe some of the floaters would go away, but the doctor explained that it's in the back of the eye where the proteins are and the debris or whatever. Just seeing if you had any advice for me.
Yeah, it's interesting. So most of the time when you have floaters or little flashing lights, it's vitreal in origin. The gel in your eye has these little floaters and they float around, and the majority of the time it's benign. And if you went to the retina center, then they made sure it wasn't a retinal tear, a retinal hole, or retinal detachment. So there's other
Correct.
things that can cause flashing lights. I mean, ocular migraines, all right, blocked carotid arteries can cause this. There's a whole host of other things that can cause it. So it's interesting they put you on steroid drops and then put you on oral steroids. I mean, it sounds like you must have had some sort of inflammation going on. Did they tell you had a swollen macula or anything like that?
No, they were the retina center noticed a small degree of inflammation, and the specialists claimed that as well. But my doctor here that performed my cataract said that he didn't see any inflammation whatsoever.
Interesting.
And he wants to wait a little bit, let the cataract heal completely, and then potentially have a second procedure done to remove whatever it is in the back of the eye.
Yeah, you can develop some haze after cataract surgery and then remove that with a laser. So that's interesting that one doctor saw some inflammation and the next doctor doesn't see inflammation. And remember, if you're on a course of steroids, maybe the inflammation has actually gone away now. I mean, that's a very good possibility. I mean, how old are you?
I'm 44.
Are you in a stressful position in life right now?
I'm in logistics. I own a transportation company, so there's a certain degree of stress involved. But overall, I would say, other than work-related stress, no, my family life is great, and I don't experience a lot of stress.
Yeah. So let me ask you: did anybody throw a big word out to you like this? Idiopathic central serous chorioretinopathy?
No, sir.
Okay.
Haven't heard that one.
So it's interesting for somebody to refer you to another patient, get on steroids, even though that doesn't help. I'm just wondering what they were treating. I mean, there's nothing wrong with, I would say the cataract surgeon's more than competent looking for this inflammation. I mean, seeing this surgeon for follow-up, I'd be more than happy to see you at the Lange Eye Institute for a second opinion anytime. I'll thoroughly educate you at least on what's going on. It just doesn't sound like they kind of educated and enlighten you what they were treating. So there's nothing wrong with second opinions, but I think you're probably in good hands. It sounds good that the doctor couldn't find any inflammation, so maybe the steroids actually worked. They did cause the cataract, but maybe it caused inflammation in the other area of the eye to go away.
Okay. Yep, that makes sense. All right. Well, I think I'd like to actually see you at some point for a second opinion.
Yeah, you can easily call the Lange Eye Institute in the Villages and just say you want to see me personally. I'd be happy to see you.
Okay.
All right. Take care.
I think I'll do that. I appreciate all the information.
All right. Bye-bye. We got a lot of great callers. Once again, the phone number for the Lange Eye Institute is 352-753-4014. That's 352-753-4014, Lange Eye Institute in the Villages. Remember, October 20th, we're having our big hoopla, this is like our 20th annual fall festival. It's going to be race car pit crew day. We're going to have T-shirts made up and everything. It's going to be kind of cool, a lot of fun. Music, free food, lots of free giveaways, lots of prizes, and lots of discounts. All right, let's go back to the phones. I think this is Hugh in Silver Springs. Good morning.
Good morning. Thank you for taking my call. I take fish oil a couple times a day for many years now, and I noticed when I was shopping for fish oil, which I ran out of, next one was Norwegian salmon oil. Would that be better than the regular fish oil, or is it about the same?
No, stay away from Norwegian salmon oil. Stay away from Scottish salmon oil. All of that is farm raised, okay?
Oh.
And so that they try to hide that. Like my wife came home one day and was so proud because she knows I love wild salmon, wild Alaskan salmon. And she came home and she says, "Oh, at the store, I got Scottish salmon." And I said, well, you know, that sounds all fine and dandy, but that means it's farm raised. Scottish salmon is farm raised. So is Norwegian salmon. It's farm raised. It's got to say wild caught. I don't love salmon oil, even wild caught salmon oil, because the EPA and the DHA is not very high on it. All right. So the other problem that I have with fish oil that you buy over the counter, 95% of all fish oil that's sold over the counter is an ethyl ester molecule. That means it has ethanol attached to the backbone. So that makes it very unstable, number one. It makes you burp back a nasty belching kind of flavor of fish. And it goes through your liver every day to cleave the ethanol off to replace a triglyceride backbone so it can absorb into your blood the way fish naturally have it in the sea. Fish don't cruise around with ethanol in their body. And so I don't like ethyl ester fish oil because of that. You can do a simple test. Bite the end of your fish oil off, squeeze it in a styrofoam coffee cup, see what happens after 10 minutes. Most of the time, it's going to rot a hole through that cup. So what you want to do is get a triglyceride form omega-3 fish oil. So you got to look on the bottle. If it says TG form or triglyceride form, it is good. You can buy it. But most of them are not going to say it. If it doesn't say it, it's ethyl ester. Not to just promote my product, but Fortifeye Super Omega is triglyceride form. You can get it right there in Ocala at Fortifeye Vitamins on 17th Street next to Wood U, Monday through Friday. And, you know, tell them you heard me on the radio, you get 20% off. So it's, you know, all you probably need is one a day. That's a 2-month supply for a little over $20. So it's not very expensive. And it works. We've got omega index studies that prove that the typical patient that weighs less than 240 pounds, taking 2 per day brings your omega index into the heart healthy zone at 2 per day. There is no over-the-counter fish oil that can claim that at 2 per day dosing.
Speaking of fish oil, generally speaking, what kind of fish supplies fish oil for those pills?
All right, so the best fish are the small non-predatory fish, all right? We use sardines and anchovies for 99% of it all. You don't want to use grouper and tuna and stuff like that. So the small non-predatory fish. And then the big kicker is, where do they actually purify and concentrate it? So, no, you know, you heard about the wine country, the Bordeaux region being one of the best for developing wines in France. Well, the Norwegian area, Oslo, Norway, not Oslo, but Oslo, Norway, is kind of like what Bordeaux is to wine, to fish oil. And they have gotten it down pat where they can make it taste good, concentrate it without any ethanol in it. So it's all where it's packaged. Now, I got to tell you, this is kind of scary, and not to knock and rag on China, but the majority of supplements you buy over the counter are coming out of China, all right? And I personally would not be consuming anything into my body. If you want to wear clothes from China, that's fine, but I wouldn't be putting something in my body, a supplement that comes from China right now anyway.
Okay, thank you very much, and good luck on the racetrack.
Thank you. I appreciate that. Have a good day. Bye-bye. I appreciate those kind words. All of you that listen, you know, I have a need for speed. I used to race motocross. You heard my days of talking about motocross track, and then mountain biking was big. And now I'm into car racing. I'm racing Dodge Vipers that are set up for road racing, 2017 models, and gotten pretty fast and gotten some pretty good lap time. So we'll see how I do at the NASA race in New Orleans at NOLA Speedway. So we're heading out Wednesday night. The rig's going to be all set up, and the pit crew meets me at the village at the Lange Institute. We'll get in the motor coach and the trailer and head on over to New Orleans and set up for Thursday night, and maybe have a barbecue. And then Friday, I'll be ready to hit the track. All right, phone lines are open. 1-727-586-2820. We're going back to the phones. Gene in Ocala, good morning.
Good morning, Dr. Lange. I wanted your input on the eye drop Comagan.
All right. Comagan is a fantastic drop for glaucoma. Are you on Comagan right now?
I just got started on it. I've been checked for every 6 months for my eye. Every once in a while, my pressure goes up, you know, and then it seems like the next time it's back down. So I don't know what causes that. you know.
Yeah, so the only thing I have issue with Combigan, you got to be a little bit concerned about being tired. That's one of the side effects. Combigan is great at lowering intraocular pressure, okay? So if your pressure gets to a point where your doctor, your optometrist or ophthalmologist is uncomfortable with it because they think it's glaucoma, then we got to take drops and treat it. So Combigan now is generic, so you can get it relatively inexpensive. It's a combination drug. It's called bromomidine and timolol, and you can use it twice a day, not more than twice a day. And if you have congestive heart failure, it's contraindicated. If you have COPD or asthma, it's contraindicated. So do you have any heart problems or lung problems?
Not that I know of. I've always had like an irregular heartbeat, but, you know, I've had that, I think, for years.
Right. Everybody does after the age of 60.
Yeah.
So I think it's a very effective treatment. It works quite well, but I want you to just be a little bit cognizant of any signs and symptoms of being overly tired when you're on that drop. If you have no side effects and they check your pressure and it came down 20, 30%, fantastic. It's a safe medication, but remember, it can make you tired. Timolol is a beta blocker. It can make you tired. And then the bromomidine, which is alpha-GAN that's in it, can also make you tired. So the combination of those two, some people get very tired. So just don't chalk it up to be getting older. It could be the medication. And then your doctor might just have a reason to switch you to something else that may not cause you to be tired. Now, is this the first drop that he or she put you on?
No, I've been on several different drops. The one I was on was Lumigan, and when I went in for my checkup, my pressure was like high normal.
Right. And so they stopped the Lumigan and then just switched to Combigan?
Yes. Mm-hmm.
Interesting, because if Lumigan didn't bring the pressure down, then Combigan probably won't bring the pressure down any more than Lumigan will. So that'll be interesting to see where your pressure goes. Lumigan, I love. It's a very safe drug. It's a prostaglandin analog. It doesn't affect your heart rate. It doesn't affect your lungs at all. So there's no side effects. Mm-hmm. And so sometimes we add something to Lumigan. So if Lumigan wasn't controlling it adequately, you could add just bromomidine or timolol and not the combination drug. I'm a big advocate of the least amount of medication that gets the job done. But I'm at a little bit of disadvantage. I don't see your visual fields or your photos of your optic nerve in front of me and how thick your cornea is, et cetera, et cetera. So I would follow your doctor's advice. Sometimes it takes a few times to find a prescription medication that brings your pressure down adequately and you have no side effects. But write this name down, all right? Write this drug down. There's a new one that's just been released called Vyzulta. Vyzulta, V-Y-Z-U-L-T-A. Vyzulta. I've had some amazing success for patients that weren't responding to their other therapy, and we've put them on that. It's just one drop a day at bedtime, and I've had some amazing results, no side effects, and the pressures come down nicely. So a lot of doctors don't even know it's available yet. So not to tell you how your doctor to practice, but if you find the Combigan doesn't work either, just say, hey, I heard Dr. Lange talking about Vyzulta. Can I try it?
Okay, V-Y-Z-T-A?
V-Y-Z-U-L-T-A, Vyzulta, just the way it sounds.
V-Y-Z-U-L-T-A.
Yes, ma'am. I think that's how you spell it. I could be way off, but I think that's it.
Okay, yeah. Yeah, well, this with these side effects of feeling tired, I've taken it for a couple of days, and I do feel differently. I usually have a lot of energy.
Right.
So do you just keep taking it or what?
Well, I would take it per the doctor's instructions. I'm sure the doctor wanted to see you back in 2 to 3 weeks to check your pressure again, didn't they?
Yes.
Yeah, so as long as it's not bad, I mean, if anything is, causing a serious problem, call your doctor and see what they say, if you're having serious issues. And then also, depending on how healthy you are, cardiovascular exercise, getting on a treadmill, elliptical, trainer, stationary bicycle, walking fast, swimming, 20 minutes a day, 5 times a week can bring the pressure down in your eye by 30%. Also, some new emerging science talking about omega-3 fish oil, especially triglyceride form like Fortifeye Super Omega, also bringing pressure down in your eye.
Yeah, I've been taking that. I've taken yours
Good.
for years.
Keep taking it.
Yeah, I take your vitamins. Yeah. Now, does this pressure every once in a while spike up in people and then go back down?
Yes, you can have a diurnal fluctuation. That's absolutely correct. So sometimes it goes higher than other times. And usually it's higher first thing in the morning. And so a lot of times I'll have patients come in different times of the day. Like when they're pressure check, one time I'll have them come in the morning, one time in the afternoon, one time in the evening. That way you can see what kind of diurnal fluctuation you're having.
Yeah, because like I said, I noticed mine's been doing pretty good. And then just every once in a while, it'll go up to this high normal. And then maybe the next time I go in, it's down to maybe 17, 18.
Yeah, I wouldn't be overly concerned about that. And once again, it also depends on, how pronounced this glaucoma is. Now, obviously, if you have super advanced glaucoma and you only have 1% of your optic nerve left, then you don't want it fluctuating at all, okay?
Yeah.
But
well, every time I take my visual fields and all that, they're fine. They're good.
Then you're probably in fine shape.
Yeah. Okay. Because thank God I don't really have a problem because they check it periodically. I go every 6 months.
Well, good. It sounds like they're on top of things.
Okay. All right.
All right.
Thank you, Dr. Lange.
Take care. Bye-bye.
You too. Bye-bye.
All right. You're listening to Ask the Doctor. I'm your host, Dr. Michael Lange of the Lange Eye Institute. Fortifeye Vitamins, Paleo Simplified. If you got a question, give me a call, 727-586-2820, 727-586-2820. Remember, October 20th is the big fall festival at the Lange Eye Institute from 11 to 3. I'll be out there with my race cars. We're going to have a big crowd, a lot of free food, free drink, a lot of giveaways. So it'll be a lot of fun. Also, remember, we started the show off talking about blue light, how blue light from all of your digital apparatuses, your telephone, your tablet, your computer, your television, the LED lighting, the fluorescent lighting is bad for you. Not only does it tell your brain to stop secreting melatonin, it tells your brain, the pineal gland, don't secrete melatonin, and then you don't sleep well. Your circadian rhythm is totally interfered with. So people become sleep deprived. But also there's new science that suggests that this blue light causes a chemical poison to actually denature the photoreceptors in your macula, causing macular degeneration. So I recommend everybody at any age taking Fortifeye Focus. That's lutein, zeaxanthin, and astaxanthin. Very good for you on the computer, the iPad, watching television. This replenishes macular pigment density, helping to protect your eye from the harmful blue light. Also reduces eye strain from the computer dramatically. Some added benefits: Fortifeye Focus helps minimize fine lines and wrinkles in the face, and it helps joint pain and joint inflammation. Amazing for the retina. Protect your eyes from the blue light. Take Fortifeye Focus. It's called Blue Light Defense at the bottom of Fortifeye Focus. Also, I'm holding up these glasses in front of you right now. Actually, I'm going to put them on for a little bit. These are Blue Light Defense glasses. They have lenses that block the most harmful rays of blue light, but they're clear. Remember, most blue light blocking lenses are yellow-brown color. These are totally clear. They block the most harmful rays of the blue light. Your children should be wearing blue light defense lenses. You should be wearing them, and you should be taking Fortifeye Focus. That's the double whammy, protecting your eyes from the blue light. Remember, blue light is associated now with macular degeneration, anxiety, depression, cancer, diabetes, heart disease, obesity. All of that is associated with prolonged digital use, and we think it's related to the blue light exposure. So think about that. Go to bluelightdefense.com, or fortifeye.com. You can actually order these blue light defense lenses. There's a few different frames on there. Use the code, the promo code. You're getting 40% off. We've never done this on blue light defense lenses because our cost is way up there. This is super high quality. Blue 40. Promo code is Blue 40. So you can get a frame with the blue light defense lenses in it for your kids or for you with no prescription, and you put them on and wearing when you're on the computer, especially at nighttime. But if you're on a computer all day long, wear these. It will protect you. You can also get it in your prescription. You would just call Fortifeye Vitamins and talk to them about that. You can get it in reading glasses, and you just put the power that you want, +1, +2, +3, in the notes section when you go to bluelightdefense.com or fortifeye.com when you're ordering. But remember, Blue 40 is the promo code, 40% off. All right, let's go back to the phones. I think Sunny in Ocala. Good morning. Thanks for holding.
Good morning, Dr. Lange. I actually have a multitude of questions, but my first and foremost, I recently heard about a contact lens that reshapes the cornea. Can you tell me just a bit about that?
Yep. So that's called corneal refractive therapy or precision corneal molding, or there's a whole host of different names, but we do a procedure called corneal refractive therapy. And that's true. We take a special lens that you wear at nighttime, and then it reshapes your cornea. It's very good for people that are nearsighted, or can't see in the distance. And it takes about 3 days for it to work. And you put it in at night when you sleep, and then you take it out during the day. And so it's great for people that don't want LASIK surgery, for athletes that are in the pool a lot, racing cars, motocross, where contact lenses aren't an option. You know, it's not cheap. It's about $2,000 to do it. Would actually probably give you 20% off if you say you heard it on the radio show. So that'd be about $1,600 to do it. I've done a lot of these, and it works, but it's not for everybody. And so people come in, and we always direct them in which direction's best for them, because now there's also 30-day continuous wear contact lenses. So people want convenience. So you can wear a contact lens, one brand out there, for 30 straight days with taking it out. That's very, very safe. So there's a lot of options. There's surgical options, contact lens options, spectacle options, and then, of course, corneal refractive therapy, remolding and reshaping of your cornea.
Thank you so much. I wondered, is that a procedure that you offer at your village's office?
Absolutely. At the Lange Eye Institute, we do that. I'm the only doctor that does it in the group. And so you would call and schedule an appointment first, for a routine eye exam first, just to see if you're a candidate. Everybody's not a candidate for corneal refractive therapy. The best candidates are people that are nearsighted, usually anywhere from -1 to -3. Those are ideal candidates with, minimal amounts of astigmatism. They work phenomenally well. I mean, I've done corneal refractive therapy on patients literally 20 years ago, and it's still working and still holding today.
Wonderful. Thank you. I'm very interested in that. But my second and last question was, I have a very eclectic fiance, and she is looking for a brand of frames called Coco Song. Can you tell me if you carry those perhaps at your location?
We do carry those, and those are kind of eclectic. So that's interesting that you'd bring that up. That's a very unique collection. It's handmade, and it might be Italian, I'm not sure, but it's handmade. It's definitely not a Chinese frame. And they're gorgeous. I mean, they got some incredible, bizarre colors. And we have those at the Lange Eye Institute. Absolutely. That's one of our top sellers, and not many opticals carry that brand. We also carry the typical Tom Fords and Tiffany's and things like that. But that's a very unique and, like you said, eclectic brand. Yeah.
Well, we're coming down. No engagement ring for her. We'll get some Coco Song frames. How does that sound?
All right, Sonny. Hey, thanks for the call.
All right. Good luck racing. Be careful.
Thank you,
Dr. Lange.
Bye-bye.
Bye-bye now.
Yeah, we get a lot of good callers. I got to tell you, Sonny and Steve and Bob and the gang have been calling for years. All right, phone lines are open, 727-586-2820. That's 727-586-2820. All right, remember, one more time, and I'm just pushing this because I had a lot of emails the other week asking where people in the Sarasota area can get Fortifeye vitamins. And so the Professional Supplement Center, it's an amazing center. You go there, they got every vitamin in the world. It's not like your typical one. I mean, it's really high-end, really cool stuff. So Professional Supplement Center in Sarasota, Palmer Crossing, they carry almost the entire line of Fortifeye vitamins. So you can go there. I think they're open on Saturdays. And their phone number is 888-245-5000. That's 888-245-5000. All right. A lot of you have been on the Lange diet. A lot of you have followed me on Instagram and Twitter and Pinterest and Google, LinkedIn, and showed me actual results from the Lange diet. I appreciate that. I mean, before and after pictures. And it's amazing how many of you losing weight. The average person that I see on the Lange diet that follows it. Now, that's the big question if you're going to follow it. Now, it's really the Lange Diet lifestyle plan. So it's not just eating. In that, you'll read it. You can Google it, Lange Diet Plan. Google it, print it out, read it. So not only is it telling you what to eat, I mean, it tells you to start out with apple cider vinegar with the mother and a shot and 8 ounces of water first thing in the morning. It tells you what to eat for breakfast, what snack to eat, what time, what lunch, what snack, and then what supper. But it also tells you got to get 20 minutes of sun 5 times a week with minimal clothing. You got to do some form of cardiovascular exercise, 20 minutes 5 times a week. That's very important. So it's a Lange Diet Plan lifestyle. Not just eating. So there's a reason to get the sun. There's a reason for the cardiovascular exercise. The sun gives you valid vitamin D, valuable vitamin D that actually helps speed up your metabolism. And obviously exercise helps burn calories. Weight loss is simple math. It is. You consume, you burn more than you consume, and you'll lose weight very rapidly. But my average patient, if they follow the Lange Diet Plan, loses 6 pounds a week safely. This isn't the Atkins diet. This isn't a low-carb diet. I mean, this is a modified, low-carbohydrate, high-protein diet with lots of vegetables and some fermented foods in it, and it works. There's a method to this diet. The fermented food actually helps go into your intestinal linings and helps chunk off this impacted garbage that's in your intestines, and then basically you poop it out. And that's another reason you lose weight fast, because of this stuff that's been impacted in your intestinal linings for so long. So the diet does work. You lose it very quickly, and it's a healthy diet. So check it out online, langediet.com. You can call Fortifeye Vitamins, and we can send you a copy of it. The diet does consist, one of your meals a day is a combination of our Fortifeye Super Protein, 1 scoop, and our Fortifeye Blue Green Superfood, 1 scoop, which is selling like hotcakes. Shake it up in a shaker, drink it down. That's 1 meal a day. Sometimes it's breakfast, sometimes it's lunch, sometimes it's supper. And then the meals consist of protein and vegetables. The snacks have a little bit of fruit, nuts, and seeds. And I give you a variety of different things you can choose from. All right, let's go back to the phones. Joyce in Safety Harbor, good morning.
Good morning, Dr. Lange. I know you're running out of time here, so it's real quick. One of the first ones that got your blue blocker glasses.
Right.
They're non-prescription, but I love them when I watch TV or computer, anything like that. But now I have glaucoma, and then I had to have a cataract surgery after a trab was done on me.
Right.
And my question is, they give you those free wraparound dark glasses to wear. And are they safe? They claim that, yes, they're going to block out everything. We wouldn't be giving them to you if they weren't. They got very upset with me when I asked them. But I want your opinion.
Right. So those block the UV light, okay, the ultraviolet light. They do not block the blue light. Then they might block a little bit of the blue light. I mean, so in a perfect world, and when you go outside, put your blue blocking lenses on, the blue light defense, and then put those, they're like fit overs, put them over your blue light defense lenses, because as you know, the blue light defense lenses are clear. So you walk outside, your cataract's going to be removed. You're going to be very light sensitive. So yeah, those will shade you. They will block the glare. They block the UV, but they don't block the blue light, but you put them over your blue light defense lenses, boom, your eyes are totally protected. Now remember, after cataract surgery, it is more important for you to wear those blue light defense lenses indoors, especially because the human crystalline lens has been removed. That human crystalline lens had some blue blocking properties inherently in the lens itself. Okay, now that lens is removed and the blue light can shine, and that's one reason people are more predisposed to developing macular degeneration after cataract surgery, because of the blue light frying the retina. Another reason after cataract surgery to wear blue light defense lenses and take the Fortifeye Focus that I have in my hand right here, once a day or even twice a day, depending on how much you weigh. Okay, the music's on. We're going to have to split.
Have a great race.
Take care. Hey, great talking to you.
Thank you.
Bye-bye. Great show. Remember, bluelightdefense.com. Use BLUE40 as the promo code for 40% off those blue blocking glasses. All right, I'm out of here. Have a great day. God bless you.